Welcome to Community Health Matters. I'm your host, Amy Marsalis. Today, we'll learn about TennCare Kids, a program providing free checkups and healthcare services for children with TennCare. Joining us are Dr. Joel Bradley, Chief Medical Officer of UnitedHealthcare in Tennessee, and Dr. Vaughn Frijon, Chief Medical Officer of TennCare. Pediatrician Deanna will also share tips and insights on getting the most out of your child's health checkups. Finally, registered dietitian and nutritionist Mckel Hill will join us to talk about helping kids make healthy food choices. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. We're back, and Dr. Bradley, Dr. Frijon, thank you both so much for coming in today for this important information you're going to share. We know you're both involved with helping access critical healthcare information for low-income Tennesseans. I'll start with you, Dr. Bradley. Tell us a little bit about your role as Chief Medical Officer for UnitedHealthcare Community Plan of Tennessee and what your responsibilities are in that role.
Sure, Amy, and first, thank you so much for letting us be here today to talk about this important subject. My role at UnitedHealthcare is to ensure that all of our members have full access to all the benefits that they have under the TennCare program, including the 300,000 plus children who have the benefit of good preventive care. And
a lot of these people probably don't even realize that they could have access to this care. That's key, isn't it? Communicating to those people.
It really is, and we appreciate the opportunity to get the message out, and we do it in multiple ways.
Dr. Frijon, what are your responsibilities as the Chief Medical Officer? You're over TennCare. Huge responsibility for you.
Yeah, well, I also thank you. It is a real honor and privilege to be here today representing TennCare. I'm the Chief Medical Officer for the TennCare program, and TennCare is our state's Medicaid program. We cover about 1.5 million citizens in the state of Tennessee. That's about 25% of our state's population, and about 2/3 of those individuals are children. So we cover about half the children in the state. And one of my main areas of focus is our early periodic screening, diagnosis, and treatment program, which in Tennessee we call TennCare Kids.
With TennCare Kids, are you talking about, from babies, from infants on up to what age?
Yes, so for TennCare Kids, for our EPSDT program, we start really at birth, and for our purposes, we consider children to go up to the age of 21. So the EPSDT program goes from birth to 21.
And a multitude of services, obviously. Can you go into a little more detail on the kind of services that you provide?
Really, we provide a whole spectrum of care available to kids from 0 to 21. And it starts with screenings, so we try to encourage children to get in for their appropriate screening patterns, and we follow the guidelines of the American Academy of Pediatrics, and those screenings usually comprise at least 7 components. It's a health history, physical exam, immunizations when they're appropriate, lab work, dental and vision and hearing screening, behavioral and developmental screenings, and then finally health education. So it's opportunity for parents or guardians or children to raise any concerns they have about their health, but also for their physicians or their healthcare professionals to communicate and to start a relationship that can continue from there.
And I read in some of my notes preparing for the show that kids should have as many as 12 checkups even before the age of 3. Is that right?
That's correct. We follow the AAP, the American Academy of Pediatric screening guidelines, and that includes 12 screenings up to the age of 3. And that breaks down to 7 in the first year of life, 3 in the second year of life, and 1 in the third year of life. And then basically every year after that up to age 21. So that's correct, 12 in the first 3 years of life.
Okay, now Dr. Bradley, back to you. What makes these screenings so vital to children? Obviously, you're laying the groundwork in a way, foundation for the rest of that child's life, I would assume. So if you could sort of expand on why these screenings are so critical.
Sure, I think it gives the parent, and as the children get older, a time to have a relationship with a healthcare professional that really sets the groundwork for their ability to manage their care as they get older. The reason there's so many screenings is that with children, teenagers, certain things present at certain times. So that if you have an exam at 1 month of age, there's certain things that might occur then, certain things that are on the mom's mind, sleeping at night, feedings. But if you go to 3 or age 4, there are different things that are on the agenda, both for the history and the exam. So I think multiple periodic screenings help the family establish a relationship with the doctor, but also help detect early in the course of events things that need to be treated.
And obviously, if you intervene early or diagnose autism, whatever it may be, early on, you can have a much bigger impact on that child and helping them develop, correct?
That's exactly right. So early diagnosis leads to early treatment.
Also, I wanted to ask you, are these screenings covered by insurance then? I'm assuming they are.
They are. So we cover those as part of the benefits. So the screenings are covered, as well as any conditions that are discovered in the treatment of those.
Okay, Dr. Fajan, when should a child get a TennCare Kids checkup? What's the age, the appropriate age?
Well, the screenings start really within the first week of life, and that's the 7 screenings that should occur during the first year. And then there's a pattern, a schedule that goes from there following the AAP guidelines. And so probably the most important thing is to develop that relationship with your pediatrician or other healthcare provider as soon as possible after the child is born, and then follow the schedule from there. And our physicians and pediatricians and providers across the state are very aware of our program and what is available. And so once that relationship is developed, you'll be able to continue with the same provider moving forward from there. And as Dr. Bradley said, our goal is not just to screen the children, but to identify opportunities and concerns and problems early on and try to intervene and treat those as soon as possible so that they don't become bigger problems down the road.
Two more things I want to touch on in this last minute before we wrap up. Where do parents take their kids for the well child screenings? And does a parent need to take certain records to those appointments? Either one of you.
So I think if you're new to a practice, take all the records you have, your immunization records, any records from previous physician or provider. So always helpful to get all the information there. The other thing I would say about what to take is take your agenda. This is your time as a parent or as a child or teen to lay out the things that you're concerned about. So write those down on paper and take that with you. Give them to the nurse when you check in.
And just take them to their regular physician, pediatrician or general practitioner.
That's right.
Okay.
We want every one of our TennCare patients to develop a relationship with their primary care pediatrician or other healthcare professional, and so we will help to encourage that and develop that relationship moving forward.
It is all about relationships.
Yes.
Thank you so much, Dr. Bradley, Dr. Fajan. Appreciate your time.
Yes.
Okay.
Thank you.
We'll be back with much more right after this. We're back, and I want to thank Dr. Bell for joining us today. Appreciate you coming in.
Thank you for having me.
Sure.
It's a pleasure to be here.
And Dr. Bradley, thank you for sticking around for another segment.
Certainly, glad to.
We'll jump right in here and ask you about the importance of these regular checkups for these children, the low-income children in our state, and the free services we need to emphasize. As a practicing pediatrician, doing these checkups all the time, what are you looking for?
You know, the well checkups are very valuable opportunities for us as pediatricians to sit down with the family while the child is not ill and there's no crisis moment, and to be able to look over the whole health of the whole child. And so we're looking in these well child checks for hundreds of different diseases, developmental problems, social, mental health problems. And so those opportunities are really important for us to be able to do just general screenings for anything that might be going on that could adversely affect the child's health.
In that window of time, how can you discover, how can you assess and find out so much critical information in that short amount of time?
That is a very good question. And even as a parent myself, I have gotten frustrated with the amount of time it takes me to go through my well child visits at times. And there's a lot of paperwork that we ask parents to fill out. But I think that the important thing is that that paperwork has lots of questions, and every single question tells us something that's very important about screening for a particular disease or a particular developmental delay. And so it is just so important for us to be able to do that. There are hundreds of questions that we ask in doing appropriate developmental screening. And each one of those things helps us identify a specific disease that the child might be at risk for. For example, we often use what's called a PEDS score form, and there are 10 questions on that particular tool. And that helps us screen for developmental delays of speech, of motor and fine motor development, of social development and autism, and also for other emotional or mental health problems.
What do you see the most in your practice? What kind of situations, conditions?
That really varies by age. In the under 3-year-old or so age group, we see a lot of developmental delay, so fine and gross motor delay, language delay, and that's really that valuable opportunity to start to see signs of autism. And so we can diagnose autism and again get them in for early treatment, early therapy. From the 3 to 8 year or approximately 8-year age range, we can start to see some learning delays. We start to see ADHD in that age group, and so those are very important things for us to detect in that age range. When you get above 8, we start to see some anxiety and depression, so we're very heavily screening for mental health disorders in that age group. And then as they move into those preteen years, we start to look for things like substance and alcohol abuse.
So thorough. Wow,
yes.
so thorough. Now, Dr. Bradley, those are very complete screenings, it sounds like. What if the pediatrician finds something, then what?
Yeah. So I think the nice thing about this program, TennCare Kids, is that when conditions are encountered, discovered, then the physician and the parent make a plan, and those treatments or further evaluations are covered. That may be done the same day. It may be a return visit, or it may be a referral. So a child has a vision problem, there may be a referral at that point to an eye provider. If there's a problem that turns up on the dental or oral examination, then a referral is made to a dentist. And there are times when that's the first time the child has ever seen the dentist. So there are good connections that are made.
Again, relationships are important, developing those relationships with the physicians. Why is it some parents aren't taking advantage of these free exams, this free care? They just don't know about it?
I think that's part of it. Medicine's come a long way in the past 20 years, and back when I was 12 years old, there wasn't a whole lot that was done at my well child check visit.
No.
But now there are so many things that we're screening for, and so many new medicines and therapies that we have, immunizations that we didn't give even 5-10 years ago. It's so important for us to be able to give those, and thinking prospectively, not just about childhood infectious illness, but now we have vaccines for things that can prevent cancer in these children when they're 50. So it's very important that we're thinking about those things and getting those adolescents in.
Speaking of immunizations, a lot of talk about immunizations for the past several years in the news. How do you make a parent comfortable if they say, no, I've heard that can lead to other problems? How do you assure them, reassure them?
Yeah, immunizations are probably one of the most studied aspects of pediatric medicine that we have. All the immunizations that are routinely recommended on the AAP schedule have been through years and years of research to make sure that those vaccines are safe and effective at preventing the disease before they're put on the market. They're also well studied to make sure that the side effects of the vaccine are much less than what the problems of getting the actual disease would be.
Okay.
So those therapies are very well studied before they're put on the market.
Dr. Bradley, remind us again, for parents maybe just tuning in, how do parents get the screenings for the kids? If they don't know, where do I go, who do I call?
Yeah, so all the health plans in Tennessee that work with TennCare do as much as possible to eliminate the barriers. So the first call should be to your child's physician or healthcare professional. So
right.
that's where the exam is best delivered. If there's a need for assistance scheduling, then if you will call the number that's on the back of your card, your insurance card, you'll get assistance scheduling. If you need a primary care physician or need a reminder about who that is, same there. And oftentimes it can be a warm transfer from that call to the primary care physician's office. We also offer transportation. So if you find the transportation's a barrier, that same number will get you to our transportation services where you can arrange a ride to the doctor and a ride back.
So no reasons no excuses for not taking advantage of this. Thank you both very much. And we'll be back with more of Community Health Matters right after this. And we're so happy to have Mckel Hill here. Thanks again for being here today.
Thank you so much.
You know, we hear about fad diets, it seems like daily, weekly. What's your approach to helping parents to get their kids to eat better?
You're so right. It's confusing. And that's why I really started Nutrition Stripped about 3 years ago, to create a platform, a resource for parents, for everybody, to really get wellness and balance under control. And you know, at its core, healthy eating is really, it's not complicated. As long as you have the tools, the resources that you need, you can make it work for you and make it really fun and delicious.
Well, you know, the rate of obesity is so high, especially in our great state. And it's just climbed, the rate of obesity among children, adolescents in recent years. So what are really basic tips that parents can use to get the kids on the right track?
Yeah, I think the biggest one is being a really solid role model. And I know that's kind of hard for a lot of us to think, but to get back to the core of what whole foods are, and eating a lot of fruits, vegetables, nuts, seeds, beans, legumes, and making that work in your daily life. Also, a really big tip is to prepare ahead of time. So always making sure that we have healthy food on hand, snacks, lunches. If I were to kind of give you a blueprint for healthy lunches, it would be to have a couple servings of healthy fats, carbohydrates, protein, veggies, really simple. So anything that you would make for lunch or snacks, that can be a really good start for them.
How about, okay, you're packing, let's say you're packing a child's lunch.
Yeah.
What would be the perfect child's lunch to pack?
So depending on their preferences, this would be an ideal
tough question.
situation,
Okay.
right? So maybe half of an avocado with like a little lime and sea salt. I know I might be getting deluxe here, but it's really simple. That's a healthy fat. And it's gonna give you a lot of vitamins and minerals too. And then maybe it's chicken or a protein that they like, or beans, veggies, maybe they like carrot sticks or celery, and then having some water or tea, which is actually really great for antioxidants, some caffeine-free tea. And that would be a really good lunch. And then maybe some carbohydrates like oatmeal or sweet potato or something.
What if they're super picky though? What do? Do you have to hide things, trick them?
You have to be a little sneaky,
Yeah.
a little bit sneaky.
Okay.
So I think the easiest way to sneak in some veggies is smoothies. They're so easy
Perfect.
for breakfast. You can even pack them for their lunch, but make them engaged and make it relatable to them. So one of my biggest tips is to make a green smoothie. It's green, it's fun. You can call it the Incredible Hulk, or you can, you know, make a bright colored smoothie with fruits and vegetables and make it relatable to them.
That makes sense. That totally makes sense. All right, the foods that are most important for kids in their development with the right vitamins, what are they?
Yeah, this is a great question. I think it's so crucial to their development. So if we think about kids' growth, that's the main theme that we need to pay attention to. So really getting those nutrient-dense foods and making the biggest nutrition bang for your buck, if you will, with every meal. So omega-3s, so walnuts, salmon, if they like salmon, that's great because that's one of the best sources. Chia seeds, hemp seeds, those are other great sources of omega-3s. And then I would also say probiotics. So a lot of people don't pay attention to probiotics, but we really need to care for their gut health, and that's really going to help their immune system as well. So yogurt, kefir, fermented vegetables, and kimchi, which might sound a little odd, but you can find them at any grocery store here in Middle Tennessee. And then also protein, things for brain health as well. So those would be the foods that I would concentrate most on.
What's off limits? What is off all your lists for children?
I would honestly say the same foods I would limit for adults, I would limit for children too. So refined sugars, processed packaged foods, trans fat, soda, candy. I don't want to ban them, right? We don't want to use that word ban, because we also want to create a good behavior around food and how they can create balance in their adult life. But definitely those resources.
What are some of the common food myths, things that, you'd like to clear up?
I'd like to clear up a lot. But I would say the biggest that I hear from clients is an all or nothing mentality, that we have to be 100% healthy all of the time.
No sugar, ever.
No, yeah, just really strict. And to be quite honest, that's just not enjoyable, because food is so much more than physical nutrition. It's cultural, it's emotional, it's mental. So I like to have an 80-20%, and we can apply this to kids as much as we can apply it to ourselves as adults. But 80% of the time, eating nutrient-dense foods as healthy as possible, and then the 10 to 20% wiggle room, maybe chocolate or pizza or candy. But again, this really instills that balance and a really good relationship with food for kids.
Yeah, denying, it's like a strict diet. You want it to be a lifestyle. I hear that over and over, because diet just sounds like you're denying somebody something. It has to be part of an entire lifestyle. If you could help educate both kids and adults about eating, for good health, what's your message?
I would say to keep it simple. That's it, really to keep it simple. So to visit, especially in Nashville, we have such a beautiful community of farmers markets, CSAs, so really getting to the root of whole foods, which fruits, vegetables, beans, nuts, seeds, high quality protein. So think about things when you look at the food, there's really not an ingredient list. An apple is an apple, almonds are almonds. So really getting simple. And I think that's the best way to start.
I wanted to go back to something you said about smoothies too. If you're doing a smoothie, that obviously is not something that's going to be real easy though to send with kids to school, is it? Or is it something you could
do a
freeze
cooler?
it?
Yeah, you could do a thermos or a cooler. If that's not an option, a couple other things. Butternut squash, like pureed squashes or root vegetables, are really nice alternatives for, let's say, like mac and cheese. So you're decreasing the cheese and the cheese sauce, and you can use butternut squash. Another one of my famous recipes is a dark chocolate avocado mousse. It's delicious. Like, everyone loves it, but it's a great way to sneak in avocado, which is healthy fats, vitamin E, potassium, fiber, all of that really great nutrition.
Do you counsel much with children, one-on-one, where you talk to the kids? Is it more getting through to the parents? You've really got to teach the parents.
I do. I don't coach kids. I coach parents and moms most. Yeah, and then you do have to start that education. Like I was talking about, they really are the role models, so we have to build that foundation.
Well, Mckel, you do it all as as a coach. Really, you're teaching, coaching, writing a book, blogging. She does it all. Thank you so much for spending time with us.
Thank you, Amy.
Appreciate it.
Thank you.
Thank you for watching Community Health Matters. Learn more ways to improve your health at communityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.